Hi friends, I am Dr. Pramod Jog. I am a practicing pediatrician in Aundh in Pune, and I am also the professor of pediatrics at the D.Y. Patil Medical College in Pune. Today we are going to discuss few aspects of allergic rhinitis and its management. It's a very common problem in our busy OPD. What it means is the inflammation of the nasal passage, and it is characterized by sneezing, itching, rhinorrhea and congestion. Some children, they do have a post nasal drip, and if two or more of these symptoms are present in a child for more than an hour a day, then it is called as allergic rhinitis. Many times we get children with frequent cold going on for a long time. They are the children with pure allergic rhinitis. They may come to us seasonally, maybe in August or September. That is called as seasonal allergic rhinitis. Usually they are allergic to pollens, while there are a few who are called as perennial allergic rhinitis, and these are the ones who are allergic to some allergen inside the house, like the dust mite, and we will be able to find out what is the problem in case if we go into the history. Many children do not come alone with allergic rhinitis, but some of them have headache, facial pain, sometimes fever. They are the children with rhinosinusitis. Rhinitis is many times associated with sinusitis, and that's why in majority of the cases it is rhinosinusitis. There are a few children who have associated pain in the ear, and they are the ones who have otitis media as an association. There are a few who have mouth breathing, snoring, and they are the ones who have enlarged adenoids along with allergic rhinitis. And there are a few who come to us for frequent cough and cold, and they have to be put on inhalers, and they are the asthmatics. My dear friends, 80% of children who have asthma have associated allergic rhinitis as a comorbid condition, and one should be very much aware of this. While 30% of those who have allergic rhinitis may have in the future asthma. It is important that we understand the basis of allergic rhinitis. Children with allergic rhinitis have inflammation, chronic inflammation of the nasal passage, which is associated with IgE production after exposure of the nasal mucosa to an allergen. And this particular allergic problem is not seen only in the nose, but it is also seen in the eye, and that's why some of these children have associated allergic conjunctivitis, and they have itching of the eye and watering of the eye. Some of them have eczema, some of them have family history of asthma or atopic disease. So it's a combination of all these in a given child. However, if a child has unilateral discharge, if a child has purulent discharge, if a child has epistaxis or anosmia, then it is not allergic rhinitis. My dear friends, when a child has sinusitis, he has anosmia but also halitosis. So I remember a teacher who used to tell us that a child who has this particular problem will not know that he is smelling bad for others while he cannot smell himself. So there are different dimensions of this particular problem. Quite a few children come to our OPD with common cold, and one should know as to how to differentiate common cold, which is usually viral, from allergic rhinitis. A child with common cold will have associated fever and constitutional symptoms, and duration usually will be for about 7 days, while a child with allergic rhinitis won't have fever. And in a child who has allergic rhinitis, the nasal mucosa will be pale, while in a child with common cold, the nasal mucosa will be red. The duration of symptoms in common cold usually, as all of us know, is not more than 7 days, while allergic rhinitis can continue for a longer period. One should be aware of the associations of allergic rhinitis, which I have already told you. I will repeat: they are sinusitis, adenoid enlargement, ear involvement, and asthma. Now, allergic rhinitis child, if he continues to have these problems for a long time, can have certain findings. He will always have itching of the nose, and you will find his hand always near the nose because he has itching. Sometimes he will have an allergic salute and he will put his hand so that the nose is lifted, and this is called allergic salute. There will be a line which will be seen just at the junction of the nasal cartilage and the nasal bone, and there will be dark circle around the eye, and these are the children who are called as allergic shiners. Allergic rhinitis is very common, and that's why it has been classified by ARIA classification, which stands for allergic rhinitis and its impact on asthma. So a child with allergic rhinitis can come to you intermittently, or he may come to you persistently. He could have mild symptoms or he could have moderate to severe symptoms, and depending on these there are 4 different classifications. Remember, if the problem affects his daily activities or the sleep, then he is called as a mild category allergic rhinitis. There are different modes of therapy for allergic rhinitis. Of course, the most important is avoidance of the allergens. As I told you, it is easy for parents to find out what is the problem inside the house, and that's why dust mite, which is the most common allergen, should be taken care of properly. You have to remember to boil the linen at 130 degrees because the dust mite doesn't get destroyed at lukewarm water. One should also be aware of the fungus inside the house and also the excreta of the cockroaches. Also, the mosquito coils can create an allergic problem in some children. There are children who are allergic to some outdoor pollutants and allergens. You have seen so many children who go to the school on a scooter standing in front of the parent on the front side, and the exhaust from the truck usually produces allergy and allergic rhinitis. There are some children who are allergic to the dust in the playgrounds. One should be aware of the 2 points related to allergic rhinitis. Number 1, the seasonal, related to the season and the pollen count, and the second one, the indoor allergens. It is usually not required to do the testing for allergic rhinitis unless the child has severe symptoms which are not controlled by medication. There are certain medications which are used for the treatment of allergic rhinitis. There are certain medications which are used for the management of allergic rhinitis. One of them is the use of oral antihistamines. The first generation antihistaminics are associated with drowsiness and impairment of cognition, and that is why they are avoided. The second generation antihistaminics usually do not produce drowsiness. They are safe and also safe for the long-term use, and that is why they should be preferred. One can also use intranasal antihistamines. One can also use intranasal steroids. One can also use leukotriene receptor antagonists, and one can also use immunotherapy. We are not going to discuss these aspects in details in this particular talk, but one should be aware that the antihistaminics which are to be used in the oral category are always second generation antihistamines. However, allergen avoidance remains the mainstay of therapy. My dear friends, allergic rhinitis is a very common problem in a busy OPD. One should know that when a child comes to us with sneezing, rhinorrhea, itching and congestion, one should diagnose allergic rhinitis. It is a common association with asthma, and control of asthma also requires